Hello, my name is Ashley Bailey, and I am a MSN student at Liberty University pursuing my degree as a Master's in Nursing Education nurse educator. Today I'll be presenting a PowerPoint on early detection and diagnostic testing of hyperbilirubinemia in newborns. In the United States, 60 to 80% of newborns would develop jaundice in their first week of life. Neonatal jaundice is ordinarily benign and quickly resolves without sequelae, but for rare cases can be a life-threatening disorder. As future nurses getting ready to embark on the world of nursing and healthcare, it is crucial that you can identify the signs and symptoms of hyperbilirubinemia. Early detection of hyperbilirubinemia is critical in reducing complications. Learning outcomes for this presentation is that by the end of the lesson, students will be able to identify the signs and symptoms of hyperbilirubinemia. By the end of the lesson, students will also be able to identify and perform diagnostic testing of hyperbilirubinemia. So some may be asking, outside of just sharing content, how is this information applicable to me on my journey as becoming a nurse and working in the healthcare field? I wanted to open up the lesson with a scripture that made this all more relevant to us, something that we can focus on. The scripture comes from Psalms 127, 3 through 5, and it reads, "Children are a gift from the Lord. They are a reward from Him. Children born to a young man are like arrows in a warrior's hands. How joyful is the man whose quiver is full of them." I love this scripture. And one of the reasons why, being a maternal health nurse, I found so much joy and pleasure in being able to provide new parents with all the teaching they needed to go home and feel empowered to take care of their new babies. And one of the things that I think that we often forget in healthcare is that it's not just our job to check off a list of things, but it's our job to provide quality care to this voiceless population, the population of a newborn. They can't say to us what's wrong with them. It's our jobs to be the eyes and the ears of the physicians and to report things that are abnormal. As healthcare providers, we must be vigilant in advocating and providing quality care for this voiceless population who are unable to defend themselves. So, some of you may be wondering, what exactly is hyperbilirubinemia? I've never heard of this term. Well, let me explain to you. Hyperbilirubinemia basically means that there's an increase of bilirubin in the blood. Hyperbilirubinemia typically occurs due to newborns producing increased levels of bilirubin. This is known as psychologic jaundice. To further explain this, we all have red blood cells. Every 120 days, our body is breaking down red blood cells. So for newborns, it's doing the same thing. Bilirubin is a byproduct of red blood cells being broken down. It is processed through the liver and excreted through stool and urine. It is yellow in color. As mentioned, bilirubin is removed from the bloodstream by the liver, and it's excreted through the stool and the urine, which is why it's very important that our newborns are feeding. So whether they're breastfeeding or bottle feeding, they need to be getting intake so that they can produce stool and urine to help pass bilirubin. For newborns, the body may produce actually more bilirubin than their new liver can process. So the question is, what are you looking for when you're assessing your newborn? What are the signs and the symptoms that your baby may have hyperbilirubinemia? Well, the common term that we use today for hyperbilirubinemia is jaundice. And so you may see this with dermal staining in the newborn, and this usually progresses in a cephalocaudal direction. Other things that you may notice on the baby is yellowing of the eyes, yellowing of the sclera. In combination, usually with these babies as well that have hyperbilirubinemia, they're not eating well. So they may have poor sucks, they may not be producing enough wet diapers. And so when you see these telltale signs, you see that yellowing of the skin, you see the yellowing of the sclera, you have a baby that's not feeding well, it should be a cue to you to say, something is not right. And so, normally in the hospital setting, you would automatically check the baby's bilirubin before they're discharged. And this is usually done more than one time. And so if you notice that a baby is looking yellow, has jaundice, has any of these signs and symptoms, as a nursing cue for you, you should say, hey, we need to check this baby's bilirubin. So how do we check the bilirubin? Well, a non-invasive way is to use a transcutaneous bilirubinometer. We call that a TCB machine. It's portable, it's easy to pick up, it's kind of like a temporal thermometer. As I said, it's non-invasive. It's based on a principle of multi-wavelength spectral reflectance from the bilirubin staining in the skin. Now, with the TCB machine, it's not as accurate as a biochemical or a serum test. And so sometimes you may get a result that doesn't match up with the assessment. And so your baby looks really yellow, has signs and symptoms of jaundice, and you get a low TCB reading. In those circumstances, I would go to the next level of diagnostic testing, which is more invasive. So the biochemical diagnostic testing, also known as your serum bilirubin, is considered the gold standard. It's going to give you the most accurate test result. This test measures the total and conjugated bilirubin assessment based on the Van Denberg reaction. If you look over to the right, you'll notice a picture of a nurse drawing a serum bilirubin. This test is done with a heel prick. You have to keep in mind that when you're doing these testings on newborns, especially, a new mom, first time baby, she's going to want to know what's going on. And so it's very important that you explain to the mom the testing that you're doing, why we're doing it. And even with the baby friendly initiatives, if these parents want that you allow them in the nursery, if your hospital policy permits, or that you do the testing in the room, allowing them to provide the baby with comfort measures, such as suckling or soothing them. So, what is considered the normal bilirubin value? Bilirubin values are dependent upon the newborn's age, and so that's hours of life. What may be high for one newborn will not be high for another. And so an infant who is 10 hours of age who has a result of 15. That's going to be high. But if that infant was 72 hours, that number would be a little lower. And so that can be confusing. There are many tools that we have within a hospital setting that you can utilize to figure out if your baby's bilirubin level is high and if it needs action, diagnostic testing, or further treatment. Levels of 15 milligrams per deciliter in infants 25 to 48 hours of age is considered high. Whereas an infant who is 49 to 72 hours old, 18 milligrams per deciliter is considered a high value. Furthermore, you have infants who are over the age of 72 hours, and 20 milligrams per deciliter is considered a high value. These are numbers that would be alarming to the provider that allow them to know that some action needs to take place. If you look over to the image provided, it's a bilirubin tool for you to assess where your infant falls on the scale. So if you look at the bottom, the postnatal age hours, and then you look at the top, what your bilirubin result is, your infant will fall into a risk zone. And so, for example, if you have an infant who is 36 hours old and your result is 6 milligrams per deciliter, this is considered low risk. Whereas if you have an infant that is 12 hours old and the result is 9 milligrams per deciliter, this is considered high risk and your provider should be notified. So I have a video that I would like you guys to watch. And this brings everything together that we've been talking about. What's the big picture? What's the overall thing to take away from this lesson plan? One, it's that we need to be vigilant in making sure that we are assessing our newborns properly. Two is that if we are not and we miss something, the complications of hyperbilirubinemia can be life-changing for these newborns and parents. The video I would like to show you is called What If a Word Could Save 9 Babies a Day? After the video, I would like to open up the floor to allow us to discuss how this video makes you feel. What if it was you that was the parent? What if it was you that was the nurse that missed something when this baby was in your care? How would you feel? That was a powerful video, short but to the point. In closing, hyperbilirubinemia can cause neurological damage, organ damage, and make life challenging for that voiceless population that we were talking about. But with early detection, the necessary medical treatment can be delivered to prevent injury and further harm. As healthcare providers, we have an obligation to our patients to first do no harm and to provide quality health care to all those that we serve.